OBC presents Routine versus Medical, Education for Doctors. Our guest speaker today will be Dr. Eric Botts, who has years of experience in the field of optometry and is a specialist in insurance billing, coding, and credentialing.
Much confusion exists over what is the difference between a medical and routine eye exam. The reality is that there are many more similarities than differences. Let's start with the chief complaint and the reason for visit. The chief complaint directs the exam, but remember, it does not have to occur at the beginning of the exam. Often, chief complaints may arise during the exam, especially if you ask the right questions while examining the patient. For example, patients with a poor tear film or dry eyes may not offer that they are experiencing symptoms until you ask if they are currently having discomfort like grittiness or intermittent blurriness. In addition to using a verbalized chief complaint from the patient, I often document the reason for the visit on follow-up visits based on the plan from the last exam. A glaucoma patient returning for an IOP check may not remember why they were coming in today, but a quick review of the assessment and plan for the last office visit will explain the reason for today's visit is to monitor IOP and repeat the visual field that showed an enlarged defect 3 months ago. A chief complaint or reason for visit is necessary to drive a medical exam. I always perform a comprehensive history the first time I see a patient to acquire all the necessary information to properly treat them. Since the history is performed before I see the patient, there is little difference between the history for a medical exam or a routine exam. The elements of the exam may be very similar between a medical and routine exam. However, how you choose which test to perform is very different. Often during a routine eye exam, you will perform the same tests in the same order on every patient, which is fine. However, for medical exams, each test performed should be medically necessary for the patient's condition you are diagnosing and treating. Medical decision-making helps to differentiate medical from routine exams. For a routine exam, the thought process required for medical decision-making would be low or non-existent, whereas a medical exam would have a low, moderate, or high level of decision-making to diagnose and treat the patient. Finally, the diagnosis code is an easy way to differentiate medical from routine eye exams. If the primary diagnosis is refractive in nature, like myopia, hyperopia, presbyopia, or astigmatism, it is a routine exam. If the primary diagnosis is medical and correlates with the chief complaint, then the exam is a medical one.
Thank you for watching. For any questions, call us, email us, or visit our website. We hope to hear back from you real soon.